Hi, thanks everybody for joining today. I have a special guest. He has over 20 years of experience studying ME/CFS, in particular post-exertional malaise. He's part of a group that was among the first to advocate for the use of cardiopulmonary exercise testing to measure fatigue in ME/CFS. He has been invited to present ME/CFS research at the FDA and the NIH. Dr. Chris Snell, thank you for being here today.
Thank you, Jenny.
My first question was, how did you first get started with ME/CFS? You've been involved for a very long time, and back then it was hardly recognized. What made you want to get into such a complex space?
My background is in sports science. So I come from an athletic background, working with athletes. And I had a graduate student of mine that came down with ME/CFS. She was a player on the basketball team at the university I taught at. Sudden illness. I came with all the symptoms, so I'd not even heard of the illness before then. And she came to me, and we were discussing, how could we try and help this population. And one of the things that we came up with, and really it comes out of sports science, was cardiopulmonary exercise testing. At that point, nobody was providing any objective measurement of ME/CFS. In fact, it wasn't even called ME/CFS then, so it was just chronic fatigue syndrome if you were lucky. Yeah. and a few other names as well that are even less descriptive. And we came up with the idea that, maybe if we did a cardiopulmonary exercise test with these patients, it might show some aspects of the energy depletion that clearly was being described to us. So the classic symptom that I used to be able to do all of this stuff before I was sick, and now I can't do anything without getting tired. And the classic exercise test that people would have seen, with athletes, is the athlete running on the treadmill with a tube coming out of their mouth. And essentially what we're doing is we're measuring how much oxygen they're utilizing, which is the fundamental fuel, along with the food we eat, to provide energy. And it's a classic measurement of athletic performance. Most people have heard of VO2 max as a measure of your endurance capacity. And so we just started to try and implement that with ME/CFS patients, to try and have a look at how they were processing oxygen and whether that was anything to do with their problems in exercise tolerance and generating energy.
Are there any other use cases health-wise for the CPET testing? For example, like lung issues, heart issues, all those type of things?
It was widely advocated, although not widely used, for cardiovascular and pulmonary disease at the time. And so okay. there's a wealth of literature on this form of exercise testing being used with cardiac patients and pulmonary patients. In fact, in quantifying impairment and disability, we actually use the cardiovascular, heart disease, and pulmonary disease impairment scales for ME/CFS patients.
Gotcha. Can you explain a little bit what's actually happening? Actually, before I get into that, for people that have ME and CFS and come in to do the test, it's a 2-day test, right? You go in, I did it years ago, but you come in one day, you get hooked up to the machines, the bike, and then you replicate that on the second day.
Right. The background to the 2-day testing, initially we were only doing a single-day testing. Uh-huh. And what we were finding is that the patients did not look too different from somebody that was just deconditioned.
Right.
So the numbers looked like deconditioning. But what we were hearing from the patients was that the day after, or 2 days or 3 days after the test, that they were getting sicker, that they had a range of symptoms that were inflammatory in nature, the classic flu-like symptoms, aches, pains, and all sorts of things that should not be related to a test that takes at most 12 minutes. So although we call it a maximal test, you're only at maximal output for a minute or two at the most during the test.
It really took a toll on me when I did it. I was out for weeks.
And so we thought, well, can we actually measure this decrement? So we tried the 2-day test, and straight off the bat, we were seeing a deficit between day 1 and day 2 in the ME/CFS patients that is not recorded anywhere else. That very often it would be done with heart disease patients to see if you were getting a reliable test from day to day. So was this a true measure of that person's performance? And it's replicable in almost every disease that it's been used with, except for ME/CFS.
What type of deficits would you see on that second day for people?
Initially, we were with the small group that we started out with. We saw a deficit in their capacity to utilize oxygen. Since then, we've actually seen a broader range of deficits, and they're not always the same for different individuals. And that's been replicated by a lot of other people who've also started to use the testing. So it took a while to catch on, but there's quite a few people now that have replicated our results. So we may see deficits in oxygen consumption. We may see deficits in workload capacity with similar levels of oxygen consumption. But generally what we do see is what I call a reduced efficiency on the second day. So in broad terms, it's easy to explain to people with ME/CFS because they know exactly what it feels like.
Yeah, exactly.
Well, I just did this. I knew it was going to make me sick, but the next day I can't do anything.
Yeah.
You know, I managed to go out with the family. We went out for a meal. We went for a celebration. The next day, if I can get out of bed, it kills me to take a shower.
Yeah.
And so what we're seeing is that the energy you have does not accomplish as much in the post-exertional state. And that is the classic post-exertional malaise from what we call a fatigue perspective.
Would you, what's your view on doctors that tell ME/CFS patients that they're deconditioned and should just exercise their way back to feeling better?
The problem, I admire physicians greatly. That the work you have to put in just to get into medical school is tremendous. Then to get through medical school, it's a lot of hard work.
Yes.
They don't specialize in exercise physiology. They don't do it. So it's not their expertise.
Yeah.
So we can distinguish between deconditioning and other pathologies relatively easily, and particularly with the 2-day testing. So the real danger, of course, is that requiring somebody to exercise is what we know it's going to make them sick again. It's going to precipitate post-exertional malaise. And one of the reasons that happens is that people will prescribe exercise that is supposedly aerobic exercise. That's the sort of exercise that you can do for an extended period of time. You can hold a conversation while you're doing it. It doesn't push you to your absolute limits. What we know from exercise testing is that an intensity level for even a deconditioned individual may be aerobic. So they may be performing aerobic exercise, but the standard aerobic exercise regimen for a person with ME/CFS is very likely going to require them to use anaerobic energy. And that's the energy that doesn't last very long. It's sort of emergency energy. It's the energy you get when you have a stress response. It's the energy you use when you go beyond your capacity to utilize oxygen to produce energy directly. So it's a little like doing wind sprints.
Yeah,
But but
it's
all of a
interesting to hear
sudden,
you describe this because obviously, we live through this. So it's refreshing to hear someone that doesn't have ME and CFS kind of understand what that's like, because I feel like I'm in anaerobic threshold 24 hours a day. So it's
sure.
like,
And so if taking a shower in the morning
yeah,
requires anaerobic energy, that's like running up and down the stairs 3 times.
people that don't have ME, CFS, or that are not doctors or in your field, they can't comprehend that. They can't understand that. And that's the biggest hurdle to try to explain to certain family members or people that are still working and have moderate ME, is that that's a very challenging thing to articulate to people, because most people don't understand that. That's a very hard thing to express.
So when you see graded exercise recommended, then we say, yeah, but you think that's graded exercise. It isn't. That's an anaerobic workout for that person.
Yeah.
You've not measured their oxygen consumption. You've not measured their workload. You're just assuming that it's aerobic because it's at a certain level, but it isn't.
That was my next question, actually, because graded exercise therapy is such a contentious topic in this arena, and most people will tell you that have ME and CFS that they've tried graded exercise therapy, whether recommended from a doctor or they just thought that was the way. And most people paid for it in some short term, medium term, some very long term. Some have not recovered because they pushed themselves too hard and did graded exercise therapy too long. So yeah, I would agree that is pretty harmful.
So oh, well, you're only going to exercise for 20 minutes. That's nothing.
Right.
So you do 20 minutes above your anaerobic threshold, and I'll tell you, you'll realize that it isn't nothing.
Yeah, exactly.
That even the athletes with the highest level of anaerobic energy production cannot produce anaerobic energy for 20 minutes.
Yeah, I grew up playing sports. I was very athletic growing up. So when I came down with ME CFS, I wanted to fight myself out of it. I said, I'm not going to let this beat me. And I found out very quickly, there's no way I could tough it out. And that's something that I want viewers to understand, that don't try to beat this. Seek medical attention. And don't try to fight your way through this like, a healthy person fights through a cold or, something like that. We're kind of trained to fight through illness, and that's okay. But with ME and CFS, I think it's dangerous, to be honest with you. My next question is, there's a lot of people that are struggling with certain doctors because right off the bat, and again, this is a very misunderstood illness, and I understand that not all doctors are going to understand it, but they immediately blame the illness on being psychological, or people are hypochondriacs. Or do you think that CPET testing is a good avenue for them to check out, to show that they have a physical problem, that it's not all in their head? They can't fake, these tests, basically.
You can try and fake the test, but it doesn't work.
Yeah,
it's not gonna. It's not. We'll know. So there's no point taking the test if you're going to fake it, because the results are no good. We can't use them.
So for those people who've been kind of shunned and said, this is all in your head, this would be a good test for them to take and say, this is what's happening in my body.
We can verify objectively deficits.
Okay.
And we can extend that. I will extend that to symptoms as well, because I can say categorically that I know this person pushed themselves absolutely to their limit.
Okay.
Great. And so if then we see these symptoms occur after that, then logically you're going to attribute them to the exertion.
Gotcha. So I'm part of a Facebook support group. I think there's about 15,000 people in there. And I told them I was going to be interviewing you, and I asked them to add some questions in there. And there was one that I thought was interesting that I was going to ask you. So one of the questions was, do you only do 2-day testing, or have you done farther out? Because some people, their post-exertional malaise, and this is actually true with me, if I overexert myself, sometimes the next day isn't as bad as the 3rd and 4th day. Have you guys ever extended them? Is there a need for that? Or
we have done 3 tests with some people.
Okay.
Because they insisted on doing 3 tests. So some people, we tell them that if we get numbers so low on a single test, we say, if you're just looking to prove that you're disabled, we don't need to do a second test anymore.
Gotcha.
It's not necessarily going to help us in verifying a diagnosis of ME/CFS, but with the objective exercise test data. But in terms of the data we've got from a single test, that's enough. The problem with CPET is going beyond people that can't physically do one anyway. We know it's going to make people sick.
Yeah.
I mean, that's the point.
Right.
But that's not really good medicine.
Gotcha.
But unfortunately, if you're not going to be believed by your physician or your insurance company, then you need objective data. So it's a catch-22.
Risk reward kind of thing.
But if because it makes me sick, that's the evidence that I need to show that I really have a medical impairment.
Would you be able to describe a little bit to people watching what ME/CFS the second day, what it looks like compared to someone with heart disease or lung issues like COPD or these things?
We don't see, as you probably know, we have you hooked up to an EKG.
Yeah.
And so we will watch the EKG readings. We're going to watch your heart rate and we're going to watch your blood pressure. If we see any evidence of cardiovascular disease or pulmonary disease, we stop the test.
Okay.
I will tell you, we have had patients come to us that it's been shown they've had undiagnosed cardiovascular and or pulmonary disease. And that's been shown up with the CPET test. One of the problems is just because you've been diagnosed with ME/CFS, it doesn't mean you're immune from any other illnesses that people get. And the issue is that many of the symptoms of ME/CFS look like cardiovascular disease. So if you do develop cardiovascular and or pulmonary disease, then the physicians may not pick that up without some extensive testing. So we've had patients that have gone back and, thankfully we've caught cardiac or pulmonary disease. For the majority of our patients, we see no evidence of cardiovascular and or pulmonary disease.
Do you see the drop off on that second day for ME and CFS? I don't know if you noticed, is it exclusive to ME/CFS? I've never heard of another illness where that post-exertional malaise is such a factor.
We've not done a lot of other patients with ME/CFS, and we also get a broad range of diagnoses. So we're not physicians, so we don't diagnose.
Gotcha.
We're not allowed to diagnose, and we do diagnose in our heads. So we will get a patient presenting with a diagnosis that from a physician, not from us. In fact, when I write the reports, I ask them not to tell me the diagnosis, so that I'm not biased by what the diagnosis is. But we see a lot of patients that have a diagnosis of Lyme disease.
Oh, wow.
Now, Lyme disease is another controversial disease. Yeah. And if it does not respond to treatment and you get post-Lyme disease syndrome, then that looks very much like ME/CFS.
Right.
And you may well meet the requirements to be diagnosed with ME/CFS, and your CPET test may look like an ME/CFS CPET test.
Sorry, go ahead.
And there's a number of other illnesses that I refer to as surrogates for ME/CFS.
Yeah.
That you have a diagnosis, it's a preferred diagnosis to ME/CFS because the name's fancier. Or it sounds more credible, but in terms of meeting the diagnostic criteria for ME/CFS, you may well meet them. One interesting group that we've tested a couple of patients with is HIV.
Oh, wow.
And sometimes we will see, in a couple of patients we've seen who are being treated for HIV, that would meet criteria for diagnosis of ME/CFS. They're not going to get an ME/CFS diagnosis because they have an HIV diagnosis and they're being treated with antiretrovirus.
That's very interesting.
Treatments.
And do they usually respond well to that?
Well, the treatment stops them dying.
Yeah.
But they have post-exertional malaise and fatigue.
Wow, that's interesting.
It doesn't go away.
As far as CPET testing is concerned, for someone who may be considering doing the test, how can CPET testing help them avoid post-exertional malaise?
One of the things that we recommend is that people consider getting a heart rate monitor. So what we do, we have hard data, objective data about where your anaerobic threshold is and how hard you were working when you got there. And we can relate that to a heart rate.
Gotcha.
And so we suggest that people get a heart rate monitor, set it a little bit low below where your heart rate at your anaerobic threshold is. When it beeps, stop doing what you're doing and rest.
Yeah.
Until you feel completely recovered. That's not easy to do. We also tell their partner, if they bring a partner with them, that every time you hear that alarm go off, your partner is at risk for post-exertional malaise. So you stop them doing whatever you're doing.
That sums up a lot of my life, is being told to stop, settle down. I have to stop. I have a Fitbit that I wear all the time, and sure. It's hard to do. You're right. It's tough.
It is. I mean, we had one patient, we went to see that we were doing a second round of testing, that she needed to have a second round of testing because her insurance company were requiring it. And we just said, how's that heart rate monitor working out for you? She said, oh, it's great. I said, well, why haven't you got it on? Says, oh, well, it keeps going off all the time.
That's pretty good. That's pretty good. For those who are being denied disability, can CPET testing help them?
With an attorney, certainly. We have had patients that have used CPET results and pleaded their own case at the Social Security level, and it's been helpful. If the court does not read the test or doesn't understand the test or ignores the test, then it's not going to, it's only as helpful in terms of somebody pushes the point.
Okay.
And makes the case. But,
gotcha.
But there are some good attorneys out there that know what they're doing and know how to use the test.
After seeing so many people come in for CPET testing and being in this field for so long, is there anything at this point that surprises you still with ME and CFS patients?
The patients are very often well adjusted to the illness. But a lot of patients aren't. They're particularly in the early stages, that they just keep pushing themselves. So, I feel a little better today, I'm going to go and do some exercise. They make themselves sick, for 2 weeks.
Yeah.
The progress in understanding the disease is minimal in terms of resources that are put into it compared with the other illnesses, that they're not really doing the job.
Yeah.
People keep repeating the same mistakes in terms of the studies they do. Before we started, you talked a little bit about COVID, and that's the one silver lining I can see with COVID-19, is that we're starting to see those patients that are not recovering from the illness and are looking like ME/CFS patients in terms of the symptom complex that's coming up. Those patients are going to be researched to death. Sorry, I didn't mean to use that term.
Right.
They're going to be researched and researched and researched. What we have a population with what we call early onset illness, one of the problems with ME/CFS, that very often the disease is not even acknowledged for 2, 3, 4, 5 years.
Right.
They've been sent to psychiatrists, they've been sent to cardiologists.
Yeah.
They've not yet got a confirmed diagnosis. And so very often what we're seeing with those patients is we're not seeing what the illness looks like. We're seeing the body's long-term response to the illness.
Yeah, that kind of led me into my next question, which you partially answered. Do you see any research in the pipeline that is exciting, or do you see anything changing outside of the COVID research that's potentially coming? Is there anything else that you've seen that might excite ME/CFS patients, or is it still pretty slow moving, like you said, and the research isn't the greatest? It keeps making the same mistakes.
I still see it as slow moving, and of course it's even slower moving now. We're involved in a number of studies. So we're working with the NIH at the moment. We're working with Cornell University. But the problem is we've had to suspend all our research with COVID.
Wow.
We can't do the research.
Really?
We've managed to get back into doing disability testing because we have a high level of control of the environment with that. But none of our research sites have opened up again.
Wow.
They're struggling to cope with COVID anyway, let alone starting to try and bring people in that are a high risk population with COVID.
Right.
Fortunately, we've not seen any ME/CFS patient that's got a COVID infection. I expect there are people out there.
Yeah, and in the support group that I'm in, there have been people talking about it. They've all, luckily so far, and it's just, I've only spoken to about maybe 10 or 15 people. It's similar to the general population, except they're taking longer to recover from it, but they seem to make small steps. So that's somewhat refreshing to hear, because I was worried that they would have a really bad, but that's a small sample, I know, but I'm hoping that it doesn't hit them any harder than the general population, because it is disappointing to hear. A lot of people view COVID in a very, survive or die way, but I think history will look back and there's going to be a big gray area of people that have lung issues and heart issues and inflammation here and inflammation there. That'll probably tell the story, in my opinion, looking back in a decade, is a population full of sick people.
There is a post-SARS and post-MERS population, so they're both COVID viruses that have not fully recovered.
I didn't know that. Do they present themselves similar to ME and CFS as well?
Yes, some of them have symptoms that look very much like ME/CFS.
Wow, that's interesting.
But it's not a large population, so it's not well studied. So there's just a couple of studies out there, but so you could from that predict that we're going to see a number of different groups. So I think there are a number of different things that will come out of COVID. So there's the potential for permanent lung damage that we don't necessarily see in ME/CFS patients, but it's going to produce the same sort of fatigue.
Yeah, I have some friends that have had it. They're about 35 years old, healthy. They're runners, and their lungs are not the same. And they had it 4 or 5 months ago, and they feel okay on a day-to-day basis, but they can't go on those jogs anymore.
Right. But the population that will be interesting are the population that have the inflammatory symptoms that are similar to ME/CFS. So the flu-like symptoms, the aches, the pains, the brain fog. So we've seen that in post-COVID, where people complain of cognitive issues.
I think that might be the most underrated symptom of ME/CFS that people don't talk about as much. I think the brain fog is the most debilitating part. I would say more so than the physical.
I think if you ask any of the patients, it's the thing that upsets them the most. Not being able to hold a conversation with somebody, not being able to remember what somebody said to you, not being able to balance your checkbook.
That's right. And even on a
without ME/CFS that can't balance their checkbook.
Yeah, that's fair.
Including the US government. But
yeah, exactly. That's a whole nother video. But for me, brain fog is there are moments like that where I can't remember my own address that I've lived at for over a decade. But I would say on a day-to-day basis is you lose the sharpness that you once had. And it's you can't explain it. People can't tell you're going through it, but it's harder to recall things and things of that nature. For anyone who's watching this and wants to get a CPET test done, what's the best way to go about it?
If you're involved in a disability claim, then talk to your attorney, talk to your physician. You can contact us directly through the website. We won't take people without a physician's referral. So you are going to have to go and speak to your physician at some point. They can contact us if they want to understand a little more about the process. We will explain to people exactly what it entails.
Okay. I wanted to thank you for your time. I didn't want to take up too much of your time, but I wanted to thank you for explaining some of these things, for chatting with me about this. I think it's important for ME/CFS sufferers, family members, just to see people talking about these things and see the resources that are out there. It is a slow moving, research is slow moving, treatment is slow moving. So anything out there with people like yourself who are well-versed in this, talking about it, being able to put a face to the illness is very important. And I appreciate your time. I appreciate you meeting with me. And hopefully someday in the future, we could do this again. And hopefully there'll be more good news to talk about.
We live in hope, Johnny.
Yeah. Thank you.
You're most welcome.